We're going to do a wrap-up, okay? Any other? All right, well, thank you so much. We'll go to a wrap-up here. We're going to take a short break, or do you want to just go right into it? Okay.
First, on behalf of both the Constitution Project and Global Lawyers and Physicians, I'd like to thank you all for your participation today. This has unfortunately been to a lot of meetings like this. This is far and away, I think, the most constructive I've been to. And I think some of that, was to pull the lawyers out and let the doctors talk amongst yourselves, which I think is very, very valuable. One thing I like the most about it is that physicians continue, and I continue to believe they are, continue to think they're special, and that society has given them a license to help people, not to hurt people, and that you take the notion of do no harm very seriously. And I think you should, and I believe that your patients take it seriously too, and that the only way that you can have trust of the public and your patients is to take that idea seriously. I want to answer Bob's question about the Committee for Human Rights, which is not technically a co-sponsor, as I keep saying. We do have an international network that was set up by Carol. You're absolutely correct. And it's an international network of science societies. And one of the reasons it was set up is that after 9/11 with Guantanamo, the U.S. lost all credibility in human rights in the rest of the world. And our organization, representing the U.S. science group, could no longer go to any other country with any credibility and say, you're violating human rights. Because they would just say to you, well, so are you. Well, we don't care. So the international group is much more successful because they represent a broad swatch. And some of them have their own problems. But nonetheless, yes, that's a big point. A number of you have made that point, and we should underline it, that Guantanamo hurts the entire country. It hurts the U.S. image everywhere. It hurts all Americans, no matter what you think of just taking care of the patients there. So I've listed 14 things that came out of this meeting, and suggestions that people had of where we should go, and just the fact there are that many is good. The first one is, maybe I'm too optimistic, but I think we're getting near a tipping point on this issue. I think all the reports you saw that some from the report of the Constitution Project, the IMAP report, the President's statements on a number of occasions about Guantanamo. Hopefully, Steve mentioned the Senate Intelligence Committee study. Once that's released, maybe people will finally say enough is enough. We've got to do something seriously about that. In any event, whether it's here now, I think it's close. I think it is close. You don't hear anybody really defending Guantanamo, nor do I think it's defensible. In terms of products, there's two that I think should come out of the cases we heard this morning, and any group or individuals who want to work on this. I think that our first patient that we looked at needs to be transferred out of Guantanamo to someplace where he can get decent medical care. I think that's, any physician who's looked at this believes that. And that I think that's doable. There should be, he's obviously not a danger to anybody but himself. So that's number one. Number two, I think there's no justification for not releasing Latif's autopsy report, and I think we should continue to pressure to have that done. It won't help him anymore, but we should certainly learn from that. Four, I know there are a number of members of the Institute of Medicine here, and I think you guys should help me and support the new project that the Institute of Medicine is working on to bring human rights into this mainstream of medical ethics, to teach students about that, to teach physicians about that. That's really important. A lot of you have mentioned that many physicians don't understand human rights. They've never been taught it. They may not even understand medical ethics, but we'll leave that there. But those things should be important in medical school, and I think as Joe said, the only way to make it important is to put it on the exams, is to put it on step 1 and step 2. And anyone who's got any influence in that should do that. That's really, really important. It really is. Because whenever we talk about changing the medical school curriculum, the answer is, oh, you can't do it. It's just too impossible. It's already too full. That's been a standard answer for 40 years, and some of it's true, but that can be done. I think it's very important. The U.S. never learns from other countries, but we should find out about what other countries are doing, and I really appreciate Vivian's and Hans's contribution here. I really think that I want to look at her toolkit. I haven't seen the toolkit for ethical decisions for military doctors, but it's hard to object to something like that being introduced into the United States military as well. I don't think we'll ever follow the Swiss model of having totally independent physicians, but in prisons, but really an idea obviously worth considering. So, again, I thank them for coming here, and it's been very valuable. I've been convinced, maybe you haven't, that this idea of doing an orientation for doctors before they go down to Guantanamo is fine, but not effective. I think Jeff Metzner made a point absolutely right. It's going to take you 3 to 4 months to figure out what the hell's going on down there, and after that, you're on your way out. So it may be possible to deal with continuity of care some other ways. We've had some constructive ideas of having specialists or people assigned stateside who come down, once a month and could follow the person, obviously, in between there. Something's got to be done. I take Sandra's point that continuity of care means there's lack continuity of care means there's no care, essentially, that happens there. And there are ways to deal with that. The SOPs are important, as people said, but they're not a determining factor, and I agree with that. On the other hand, the ones we've seen are pretty horrific. So for hunger strikes, my own view, and many people have said this as well, is we should, we've got Malta. Malta's the international standard. We should follow Malta, and that's really, instead of trying to rewrite the SOP for hunger strikes, we should just continue the fight to try to get it replaced by Malta. I mean, that makes perfect sense. Many comments on the relationship between the military commander and the physicians. Talks about firewalls, stay in your lane. Yeah, I think the main point has got to be that the commander should no more be able to tell a doctor how to practice medicine than that he can tell a JAG officer what the law is and how to practice law, or even tell a chaplain how to interpret his religion. That physicians are professionals. That's the profession they should identify with. All right. I do take Mark Sageman's point that if you're in a fighting war, and people are shooting at you and your colleagues are taking care of you, that's like an impossible thing to do. But that's not what's going on at Guantanamo. These guys, they may be described as the worst of the worst and dangerous, but they're not. They're not shooting at you. They're not shooting at the physicians. The guards may be another thing. So I think we have to take medical ethics seriously. And Dr. Hood made this point extremely eloquently. I didn't write it all down, but that by not taking medical ethics seriously, as she said, we're destroying ourselves and destroying the vision the rest of the world has of this country. Nobody said this. I'm sure the president wouldn't say this either. But if you want to look for a place that has exclusively government-run health care, it's Guantanamo, and I don't think that's going to be that would be a model for anyone. I'm not suggesting that be a campaign issue. The suggestion that there be some kind of a committee or body of civilian physicians, experts in medical ethics, that physicians in the military could call on, even informally and even in confidence, to bounce ideas off of medical ethics trouble is a good one. I don't know who that would be, but that's a good suggestion. I think any support that we can give, that the medical profession can give physicians in the military, I think would be greatly appreciated by them, and should be something that actually the civilian physician should feel responsible to do, it seems to me. I like Ron Blank's idea of an ombudsman at Guantanamo. I don't know if anyone's ever suggested that. You're the first person I've heard suggest it. But it's a terrific idea. I mean, just have someone who actually has authority there that you can talk to and try to work, has the authority to work things out too, hopefully. The public health service idea is not a bad one either. The idea being that everything's so broken at Guantanamo that you really need to start over with a different model. And even if we can't get civilian doctors down there, public health service may be the right one, may be the idea. And finally, with Steve and others have talked about transparency and accountability, and without much hope for accountability right now, but nonetheless, we've got to start with transparency. We do have to find out the facts. We do have to figure out a way to get data. I mean, everywhere else in medicine, we look for evidence-based medicine, right? And the evidence is all secret, and there's got to be a way to pry some of that out, even without names. But we need more. We do need more evidence. You can't really solve a problem unless you know more about it. For coming out of this meeting specifically, I expect that networking has occurred. The April meeting that we had on hunger strikes, one of the things that happened there was that a number of the physicians involved in prison care, John May, Scott Allen, and others were invited to give presentations to their national organizations. And there's been a movement, I'm told, to actually come up with an ethical statement for prison physicians, and that's great. That's terrific. And I hope you all work with each other on that. We'll put some kind of a summary of just what happened today, just so you have a record of it out. I don't know how long that'll take. But I expect some things to come from this. Steve, I don't know if you have anything more you want to add to that? No? Sandra? Jerry? Yes, well, of course. I have to have our host. And again, I want to thank Scott again. I can't tell you how much time he spent on this.
Terrific. Thanks, George. I just also wanted to echo George's comments. Thank everyone again so much for coming, for sharing your insights and expertise. It's been tremendous for the Constitution Project to be involved in this meeting. I agree it's been a really productive day, and I do hope this is a step towards, if nothing else, some small positive change. I also want to note that in the coming days, links to videos for each of the panels will be available on our website. And thanks to our fabulous TCP fellow, Maria Cortina, we'll also have some of those in the Spanish translation. So take a look at those if you'd like, and I hope we'll all see each other again. Thanks.
Good to meet you.